Can I just follow on though? You've obviously set up the Indigenous Advisory Committee to respond, and just going back to your meetings, you had your first meeting yesterday, you have your next one next week. So what was your answer in terms of ongoing meetings? Is it a regular every couple of days or once a week? What have you established?
The current terms of reference contemplate that the committee will meet at least weekly, but depending on the...
And that's via phone?
Yes, teleconference. Yep. The next meeting is hosted by Nacho, so it will be at the Nacho office and teleconference.
Okay.
So it will be in a few days, so more often than weekly, and then we will decide when the next meeting will be.
And sorry, Mr. Matthews, you said it was Dawn Casey, and who was the other co-chair?
Dr. Dutaka.
Yourself, yep. Okay.
I am the other co-chair.
Yeah, Dr. Dutaka. Okay, so I note that Rural Doctors Association of Australia has joined the Royal Australian College of General Practitioners in backing calls for new Medicare rebates for emergency telehealth consultations. Is this also under consideration?
Senator, there's been a range of matters raised, as you would appreciate, including telehealth video conferencing items, looking at how we respond from the primary care sector and the Aboriginal community controlled sector. All of those issues are on the table yet, but they're decisions for government and haven't been made yet.
Okay, and given the already stretched resources, obviously, that you're having to deal with as well, what contingency plans have you got in place if this virus does break out in remote communities?
So that's exactly the nature of the discussion, both that Dr. Dutaka is leading, but also very much front and centre in the mind of the department and the Chief Medical Officer. In the first instance, really, we are trying to make sure that the disease doesn't get into remote communities and look at screening and protocols and working with communities to try and avoid the disease even entering into a remote community. There are contingency plans that are underway in terms of working with states and territories and once again with the ACHO sector in terms of if we need to set up clinics, look at primary care and ACHO responses in those communities, and any removal of people who become ill. But in the first instance, what we're trying to do is prevent the spread of corona into remote communities.
And so what, if you've had your first teleconference yesterday, what discussions have taken place around that in terms of preventative measures?
So the group discussed a range of potential preventative measures, including what we alluded to before in terms of protocols for screening and engagement with visiting providers, fly in, fly out workers, tourists, that communities could enact or for providers to undertake before travelling to community. But it's early in that discussion. We want to make sure that we don't go to the table with a preset approach that is a one-size-fits all and it's rigid in how it's implemented. We want to make sure that the measures that we take, particularly if we're talking about sensitive things like mobility into communities, etc., is consistent with what we are being advised by the group, acknowledging that regardless of this process, there are existing mechanisms in place to respond to cases as per local public health guidelines, state-led responses, and the overall response to the outbreak that is occurring at a national level. So it's not the case that nothing would happen until we have this specific plan in place. The general response that is already underway across the country would still be applied and would still be available in remote communities. We are simply strengthening our preparations for if that was to occur, and ensuring that the way we are doing it is culturally safe, empowering, and building on the strength of the community controlled health sector.
So what was one of the decisions, though, made as a result of yesterday with your meeting? Clearly you've come together. We've had coronavirus in the news since January, so it's not new, is it? So what decision did you make from that first teleconference for members to go off and start to alert regional communities and organisations?
Decisions were made on some of the work that needs to be undertaken before Tuesday in terms of drafting potential approaches to the plan in terms of providing input into our communication materials. There was a lot of discussion, as with any other sector, on the importance of appropriate communication.
In language and all the different...
In language,
Yep.
the difference between consistent and simple and effective messaging that it's not duplicating multiple channels, but also with enough flexibility for local communities to adapt or adjust, tailor to local languages. It was the first time the meeting met, so part of it was ensuring that we had the right membership, that we have the right approach to work, and that we are ready to that we explore what issues this group is needing to tackle, and that's why it was decided to meet immediately after on the Tuesday meeting, and not wait a full week for the second meeting.
And probably just also,
Mr. Matthews.
in the meantime, if the series of national guidance that Dr. Detoka mentioned before that I think we'll table has messaging in there. So in the short term, there has been trying to get messaging through the Aboriginal Community Controlled Health Service and the state governments, so that there is some messaging happening at the moment. Obviously, there's a lot more work to be done on that. Just back on the other point around the mobility community, what we're probably just also a bit conscious of is, in doing this in a co-designed way with the sector, we want to work through those issues about what the right messaging and how we do it is. We're just sort of conscious that out of things like today, what we don't want to do is a message that sort of says there's already a decision or already a blank, there's decisions made that there is limits on mobility or things like that. So that's what the group is working through at the moment. So we're just a little bit conscious also of not trying to kind of presuppose or get messages out there that aren't true until we've worked that through with the sector.
And on that, a very important message that the group agreed on, and Professor Ward was particularly vocal about appropriately, was the importance of proportionality, which is a key aspect of the National Emergency Response Plan. And it means that we need to be ready to take the appropriate measures when we need to take them, but also we need to balance the situation not to generate undue panic or fear.
With some of the concerns, and I'm sure this was perhaps even discussed, in terms of lack of adequate housing and overcrowding as a major concern, has the lack of adequate housing contributed possibly to the vulnerabilities for First Nations people across the regions?
So, Senator, we're conscious of, as I said before, we're trying to make sure that the virus doesn't enter communities. We're conscious of a range of issues that go to potential vulnerability and certainly spread in communities, including housing, including food, including sanitation. But predominantly we are trying to make sure that we stop the disease getting into the communities.
So how would, the conversations also would be around how to self-isolate in a remote community. What conversations have taken place in relation to that?
So as the Senator pointed it out, that is absolutely one of the aspects that is being discussed in the response. The current text of the series of national guidelines of the song that we have tabled includes considerations on this. It identifies a number of situations that may contribute to an increased risk of transmission and an increased risk of severity in Aboriginal communities based on what we know. Mobility being one of them, overcrowding in some areas being another, barriers to access due to location, due to lack of cultural safety, etc., being another, but also the understanding of the burden of disease that Aboriginal and Torres Strait Islander communities experience, particularly in remote locations. So this song already contains some information on potential strategies to tailoring advice so that the same requirements in terms of quarantine and self-isolation happen, but also there's maintenance of cultural obligations. For instance, the song includes some succinct advice on the importance of having conversations with families to understand what quarantine measures could be implemented, so that families are aware that, or that the health professionals are also aware that there are other ways in which families can maintain contact and still satisfy the need to establish that rapport with relatives while still respecting isolation and quarantine. So it explicitly talks about online communications or video calling to put it in the front mind of public health units and clinicians that while the standards for quarantine and isolation have to be the same across for health protection, there need to be conversations about what are the mechanisms that maintain those standards but still allow the satisfaction of cultural obligations, or having that conversations can be put in place.
Thanks, Dr. Detoka. given that we've got certainly First Nations as one sector that's vulnerable, but we are also very aware that right across the country it's the elderly, and given our concerns in relation to the aged care sector out in these regions, what are the thoughts in relation to remote aged care receiving special training and understanding around how to prevent this disease getting there?
So, Senator, I might say, and obviously you're aware at how quickly the COVID-19 issues are emerging, and we're responding as quickly as we can. Aged care is certainly an area of concern, but as are a range of vulnerable populations. So we're looking at measures that have an adequate and responsive primary care response, but take into account vulnerable populations and communities across Australia. In terms of aged care, certainly some of the measures in terms of messaging, in terms of screening and immunisation against flu for workers in aged care settings, certainly some of the measures that we've got around making sure that we've got the right infection control information going out are currently kind of live and active. So it's definitely part and parcel of the planning in looking at how do we make sure that we restrict and protect the most vulnerable from unnecessary and undue exposure and get the right information out to aged care facilities, out to communities in the appropriate means.
Okay, thank you. I'm fine. Thank you, Chair.
Thank you, Sarah.
Can I just